On the topic of reconstruction, I know women don't always do it. I was a little ambivalent about reconstruction. I kind of was thinking, you know, I've been married a while. I'm an old lady. I'm not dating. I'm not wearing a bikini anywhere. I don't really need that. But my surgeon recommended. She said, you know, really, I think you'll be unhappy if you don't. I think you really should do it. You're too young. I love that. You're 48 and people are telling you you're young. That's the only time I can remember in recent past that anyone's told me I'm too young, but it's when they're talking about breast cancer. So, you know, you're too young, and, you know, if you don't have that breast there, you'll be uncomfortable, and I don't think you'll like it. And so she strongly recommended it, and I said, okay, I went with her recommendation. She got me a plastic surgeon. I went and saw him. He discussed all of my options. There are two main options most women go with. One is called a DIEP flap reconstruction, which is where they take skin from your stomach and then some fat around the skin, and they take out the breast tissue in your breast, and then they put that fat into your breast area and then use some of that skin to create a flap. It's very important for that to have a special vein connected to your skin so that the new skin that's laid over there can grow or attach correctly or survive. And so it's a microsurgery. It's very delicate. And I think most people can find a surgeon that can do that today. But I know it's a relatively detailed and specific specialty to be able to perform DIEP flap surgery. The other option often discussed is getting expanders and then getting implants. And so basically in that case you'll have multiple surgeries where you'll have the breast tissue removed, and then the skin will be a balloon or a plastic device is put under your chest muscle and slowly expanded with water, and you go get fill-ups until you get the right size as the skin grows, and they can expand that area to look like a breast. And then when that is completed, you'll have another surgery and have that expander removed, and then an implant placed under there. I was okay with that. It actually sounds a little painful to me to have this constant expanding being done. I wasn't really keen on having two surgeries. The problem with the DIEP flap was I wasn't really keen on having such major surgery, because you really have to stay in the hospital a lot longer for the DIEP flap surgery. They have to monitor that vein and make sure that it's the blood is flowing correctly to it. So you have to stay in the hospital 4 days. The expander surgeries, you can go home, I think, even the next day. You maybe spend one night, but then there's another surgery. So there are a lot of things to consider. My doctor, my plastic surgeon, asked about the radiation. I had already had radiation to my breast, and he was afraid that the radiated side wouldn't take to the expanders that well, and he was afraid there was a greater possibility of failure of the surgery if I did that. So he recommended the DIEP flap surgery. The nice thing about it is you get a nice flat stomach at the end of it. Of course, I had plenty of fat to do that surgery. I think if you're really thin, they can take the skin and fat from other parts of your body. But I was fortunate enough to have enough of my own belly fat to make it. But I got a nice flat belly out of it. But on the other hand, it's a pretty large scar on my stomach as well. I will say this about reconstruction. When I woke up from the surgery itself, the mastectomy and the reconstruction, the DIEP flap surgery, I was not shocked. I think I would have been shocked if I had not had the reconstruction. I think I would have been less happy, and although it's not perfect, it does feel like a breast. It does make me feel normal in my clothing. I don't look odd to people. I really highly recommend getting reconstructive surgery if you're blessed enough to be able to afford it or have good insurance to have it done. So that's my personal opinion on it. If you can do it, I mean, I understand if you don't want to do it, and if you just don't care, let's just get this all over with. I can understand that as well. But for me, I was really glad when I woke up that I had had it done.